Today's event, our Evidence to Action event, is Let's Talk About Disability Data. So we're very excited about the program that we have. For those of you who I've not met before, my name is Mary Sayers and I'm the CEO of the National Disability Research Partnership. I'd like to begin by acknowledging the traditional custodians of the lands in which we're meeting from around Australia. I'm joining you here on Wurundjeri land here in Melbourne, and I'd like to pay my deep respects to the traditional owners of the land and elders past and present. And I would also like to acknowledge First Nations people with disability whose experiences and leadership remind us that disability data, like all data, sits within histories of exclusion, representation and sovereignty. I'd also like to acknowledge any First Nations people we have joining us today. I welcome you and acknowledge you and your ancestors and elders. So thank you so much for joining us today as we're talking about this very important conversation. So we know this is a topic that people deeply care about. And looking at registrations, and we've had a lot of registrations. It's almost coming up to a record, I think, for the number of registrations we've had. We have together today people with disability, family members, advocates, researchers, policymakers, service providers, students, and government representatives joining us. And that mix really matters to us because we know that you're all looking at disability from different lenses, and disability data touches all of us. But we often experience it very differently, and we're going to be talking about some of those differences today. And today we'll be talking about data, and data that is about people with disability. And that means we'll sometimes refer to terms, categories, or labels that are used in data sets, research, or government systems. Different people and communities use different language to describe disability and identity. And this terminology we know changes over time. And at times, speakers may refer to language used in particular data sets or systems that may not reflect everyone's preferences or lived experience. And we encourage you to be curious and generous with that as we navigate this complexity together. And language does matter, and we know that language matters. So in terms of today's agenda, I wanted to explain a little bit before we've designed it this way. And as always, with evidence to action, our goal is not simply to present information. Rather, we love to have a conversation to help us think about what evidence is needed, what helps evidence move into policy and practice, and what gets in the way. And today we'll start a little short provocation to help ground us in some of the big questions about disability data. From there, we'll move on to a series of case studies and reflections. And we chose case studies intentionally because case studies are designed to help us explore some of the tensions that many of you raised in your pre-submitted questions. For example, when data focuses on diagnosis but misses lived experience and participation, when people or communities are underrepresented or invisible in data, when policy decisions are made with incomplete or contested data and evidence, and when data exists but we don't have that action to follow up or the accountability. And also, importantly, what happens when people with disability are not involved in creating the data or the questions that are asked in the data? But what happens when they are leaders in shaping what questions are asked, what get measured, and how findings are interpreted?
It's fantastic to see so many people here. Um, so why disability data and why now? Australia has a lot of disability data, but having a lot of data does not necessarily mean we have a clear picture. And in many ways, disability data shapes the decisions that shape lives. It influences who gets counted, who gets funding, what services exist, what gets prioritized, and also, unfortunately, what gets ignored. And importantly, whose experiences are seen as legitimate evidence. For many people with disability and families, disability data starts long before it looks like research. So, disability data is not abstract, it's personal, it's administrative, it's exhausting, and sometimes empowering, sometimes deeply frustrating. And yet, without disability data, we also risk invisibility. If people are not counted, needs can disappear. If outcomes are not measured, inequities can remain hidden. If governments cannot see where systems are failing, change becomes much harder. So today is not a conversation about whether disability data matters. It does. The real question is what kind of disability data matters, for whom, and to what end? So on the screen, you'll see some questions, and disability data becomes more meaningful when we ask, what decisions is this data shaping? Who benefits or misses out because of how data is collected? What happens when important things are invisible in the data? And what does better look like? At the NDRP, we spent a lot of time thinking about the relationship between evidence and action. It's not just my job title, it's something that we try and do every single day in all our interactions because evidence does not automatically create change. Many of you asked versions of the same question in your pre-submitted reflections. You asked, why do we have so much data but so little change? And that's a fair question. We already know a lot about exclusion. We know employment outcomes remain poorer. We know access differs depending on postcode. We know people in regional, rural, and remote areas experience different barriers. We know First Nations communities, called communities, deaf communities, people outside service systems, and many others remain underrepresented in data or overrepresented in some cases in data that measures poorer outcomes. We know too many systems still focus on deficits, eligibility, and service use rather than belonging, autonomy, quality of life, or meaningful participation. And yet sometimes policy still moves slowly or in directions that people strongly disagree with. And that tells us something important. Good data is necessary, but not sufficient on its own. And often data tells us the what, but not the why. So evidence created using data has to be accessible, it has to be trusted, timely, connected to lived experience, relevant to policy decisions, and importantly, it has to be used. At the NDRP, that is why we focus not only on funding research, but on mobilizing evidence for action. So research by and with people with disability, not simply about people with disability. Evidence that can influence policy, programs, regulation, and practice. And importantly, this conversation today and any conversation about disability data is not only for quantitative researchers or data specialists. Many disability research teams include advocacy orgs, community orgs, lived experience researchers, policy partners, service providers, and people with deep lived expertise and experience and community knowledge, and they want to access data to help them in their work. And there may be many who may be working with linked or administrative data for the first time. So part of today is also about building confidence and understanding across research teams. But I also want to say many people already know a lot about disability data, even if they would never describe themselves as a data person. I'm the data nerd in the NDRP. Largely that's because of background and the experience of filling in forms, and my love for where that data goes. But in an ordinary sense, many people already understand disability data deeply because they live it. They are the data. They know what gets asked, they know what gets measured, and if the right questions are being asked in the first place. So, what we're talking about today is how we bring together that lived understanding of data and the important questions that need to be asked with research methods, linked data sets, and evidence building so that disability data becomes more useful, more meaningful, and ultimately more capable of creating change. We know an important discussion we will be having today will be about the National Disability Data Asset, so the NDDA, which is a long held dream of the disability community to have linked data across systems. And that work has been occurring for many years by the Australian government as different systems players, including state, territory, and Australian governments come together to link their data so it can tell a more holistic story about what works for people with disability across systems. And we are really excited about hearing from the team about this today. And importantly, we will also hear about the co-governance model of people with disability. So we're going to hear first from the team at CIDA, or Children and Young People with Disability Australia, about the work that many of you, I hope, already know about, key statistics on children and young people with disability in Australia. And we chose this example because it highlights some of the dilemmas with current disability data that is available and what is not yet available. And this case study, let's be honest, is not only about data itself, it's about how better disability data can be built through partnership. And I'm really excited to introduce the team. And I will hand over to Tess Altman first.
Tess speaking. Thanks so much, Sue. And hi, everyone. It's great to be here for the session today. My name is Tess Altman. My pronouns are she, her, and I'm the Policy and Research Coordinator at CIDA, as Sue kindly did the acronym for me already, Children and Young People with Disability Australia, the national representative organisation for children and young people with disability aged 0 to 25. I also bring living experience as a neurodivergent parent, and I live in beautiful Wadawurrung country in Ballarat. I pay my respects to the traditional custodians and elders past and present, and acknowledge that sovereignty was never ceded and that this always was and always will be Aboriginal land. And I extend my respects to any First Nations folks in the session today. Big thanks to the National Disability Research Partnership for organising this session today about the important topic of disability data. It's really timely with lots of current efforts going on across sectors to increase not only the quantity, but also the quality of disability data. This has got to be collaborative. So I'm really pleased to see a mix of policymakers, researchers, advocates, and people from the disability community in the room today. From our perspective in the disability advocacy space, we've long seen a gap in data that feels truly representative of the community that we're a part of and that we advocate for. As you're all aware, there's so much diversity in the disability population, and current data sets aren't capturing this in a way that resonates with our disability community. To dive into this more, we're going to be talking about CIDA's recently released Key Statistics report, which provides a current snapshot of children and young people with disability in Australia today. I'm one of the report's co-authors, and I'll be joined by my fellow co-author, Steph Dimov, who will be contributing via video, and Caitlin Blanche, the report's lived experience reviewer. So just moving to the next slide. Thank you, Sue. Why did we create this report? CIDA created this resource as an accessible one-stop shop for all the publicly available data about children and young people with disability in Australia across 10 key topics, including demographics, education, employment, health, the NDIS, safety, income and finance, transport, housing and infrastructure, and social and community participation. We intentionally did not want this report to be an interpretation or commentary on the data, a policy analysis, or a set of recommendations. The key purpose was to provide an accessible repository of current and reliable data. Just moving to the next slide. Thank you. So our initial idea was simple. We wanted a credible resource that we could go to for the most up-to-date information when we were writing our policy submissions and our advocacy reports. We didn't know of any such resource, so we decided to create it ourselves. But this simple starting point ended up evolving into a much bigger and ongoing mission to make disability data accessible and to make it resonate with our disability community. We wanted people to feel the data reflected them, or if it didn't, to be able to see why and where they were missing. This bigger mission was sparked early on when we established key principles to guide how we presented the data in the report. These are the same principles that we apply to all of CIDA's published content. Next slide, please. The principles we applied were for the report to use strength-based language, follow the social and cultural models of disability, represent diversity and intersectionality, and be accessible. Next slide, please. When we first started compiling the existing statistics, meeting these principles already posed challenges. First, existing data is not usually presented from a strength-based perspective. Statistics usually present children and young people with disability as part of a problem that needs to be solved. This is useful for making a case for advocacy and what needs to change or be improved, but it doesn't reflect them as whole people or the capacity, the capability, and the contributions that they make. Second, the tendency is to collect data using terms such as impairment or severity, air quotes, that come from a medical model emphasizing individual deficits, not structural barriers, as in the social model, or disability as part of natural human diversity, as in the cultural model. These medical terms often don't align with how people view themselves, and there usually isn't the option for people to define disability in their own words. This means that many people who do not relate will simply not tick the box and will hence not be represented or visible in the data. Third, and relatedly, the data does not reflect diversity or intersectionality. We went digging for data about First Nations, multicultural, LGBTIQA+, and regionally based children and young people with disability, and we could find hardly anything. Finally, existing data is not accessible. It's hard to find and interpret, even for people like us with a research background. It's fragmented across sources, and it's hard to know what is the most current information. This is a known issue, with the Australian Institute of Health and Welfare's Australia's Children report already recommending integrating data from multiple sources to improve understanding of how children and young people's wellbeing or service use differs among different populations and geographic groups, where data might be only available in one data set. There's also issues with equity of access. If you want to do deeper comparative analysis, you need extra tools and skills like Table Builder, or often more information about specific groups is reported in peer-reviewed journals behind paywalls. It's also not generally available in accessible formats. So what did we do differently? Next slide. Thank you, Sue. Our report doesn't solve these challenges, but what we did differently was we openly acknowledged and grappled with them. At key points during writing the report, we workshop challenges with CIDA staff who have lived and family experience of disability, and with Caitlin, our lived experience reviewer. Together, we came up with ways that we could start to address the challenges. We created a glossary at the beginning of the report that openly presents some of the issues around how disability is defined, including the lack of representation of intersectional groups, the gendered nature of diagnosis and misdiagnosis, and the lack of data on trans and gender diverse young people with disability. We presented strengths-based data where possible, such as the section of our report on social and community participation, which notes the immense amount of volunteering, care work, and lived experience peer work that's undertaken by young people with disability. Unfortunately, this is really hard to quantify due to lack of data collection, but it needs to be better recognised. We created specific highlighted sections explicitly looking at what intersectional data is available on each topic and highlighted sections that point out missing data gaps. We make suggestions in the report for what impact this could have and what data is needed to fill those gaps. We made sure the report only presented publicly accessible information as well, so not information that was behind paywalls or required extra tools to access. And we did this because we wanted it to be that credible repository of information available in the public domain. We also created accessible versions of the report in plain language, easy read, and screen reader compatible formats. This work wouldn't have been possible without our partnership with Steph, who's based at the University of Melbourne's Disability Institute. We were so lucky to have her contributing as a pro bono consultant for us, bringing her extensive expertise in disability research, her rigor, expertise, critical capacity, and resourcing that we just would not have had as a disability organisation otherwise. We appreciated Steph's deep commitment to trawling through the overwhelming amount of data and pinpointing the gaps. And as advocates working in a fast-paced policy environment, it helped us have a more holistic and long-term lens on what's needed.
Partnering with CIDA gave the project a kind of grounding that I really valued. So there was always a clear so what around developing this report, a real, working with a real organisation like CIDA. They're working with real families, real young people, and there was a genuine need for this resource to actually land and be very, very useful. So there was sort of a very practical element to developing the report. It also gave me a much clearer picture of who we were making this for. So working with CIDA, who are actually on the ground, working with young people, working with families, meant that the audience never felt abstract to me. And it also kept me accountable in a good way as well. So having CIDA in the room or me being able to attend meetings or ask questions meant that I was always thinking about the gap between what the data was showing and then what people were actually living and experiencing as well, which is something I try to do often in my academic work. But that tension is very important, and this partnership actually often kept that very front of mind for me. And then on a very practical level, CIDA brought knowledge that I just didn't have. So what questions was the sector sitting with? What already existed? Where were people hitting walls, trying to find and use this kind of information? And so that was genuinely invaluable to the project, I think. One assumption I kept coming back to when developing this report was the idea that more data automatically means better understanding of something. And so what I found was that it really depends on the foundations. So if the frameworks or the definitions aren't quite right, or if the right people haven't been involved in shaping that process, more data can actually end up reproducing some of the same gaps at a larger scale rather than really filling them. So there's also something worth sitting with here around the assumption that publicly available data is comprehensive. So the gaps are actually quite substantial. in the publicly available data. And when I say publicly available, that's to sort of people in the general community that might not have academic ties to a university like I do, for example. And so these gaps tend to cluster in particular places. So these are often around the experiences that are hardest to capture, but are certainly most important to understand. And so I think it's really worth naming that data isn't neutral. So even if it can feel that way sometimes, so every data set reflects decisions about what to measure, how to define it, who to ask, and what to do with the answers. And so those decisions are made by people and institutions with particular perspectives, and that shapes what the data can and can't show. So recognising that isn't really necessarily a criticism, it's just part of using the data well and being transparent about what the data can achieve. Clearest gaps that I kept coming back to and thinking about when putting together this report and gathering the data and looking at some of the statistics was around longitudinal data. So we have reasonable snapshots of what's happening at particular points in time, but we have very little data that actually follows children and young people with disability through key moments. And those might be moments like leaving school, moving out of home, that kind of thing. And so those transitions are often exactly when things can get very complex for people and have sort of long-term effects on people's lives. And so it feels like that's a real significant absence. There's also a gap around outcomes that actually matter to people. So this is something that certainly working with CIDA has illuminated for me, and in some of my some of the work that I do, the qualitative work that I do, and some of those things that matter to people around quality of life, social connection, having a say in how you live. Those are things that people will often talk about rather than just service use or clinical measures. And so we don't have very good sort of measures or data on those things that matter to people. And those things are definitely harder to capture, but they're often what people are most concerned about, which I think is important to acknowledge. And then there's a question of who's really falling outside of the systems that we do have data on. So children and young people who aren't on the NDIS, for example, who aren't in mainstream education, who are in contact with the justice system, they often don't show up in administrative data, which means that their experiences can be really hard to see from a policy perspective. And I think one of the things that I'd love to see more of is data on barriers. So not just participation rates, but the why behind that and those rates. So what people tried, what didn't work, where they hit walls, and that context is often missing and is often very essential. So quantitative data can tell us that something is happening, that a gap exists, for example, that a rate is high or low, but usually it can't tell you why or what it feels like or what would actually need to change. And this is where lived experience data or qualitative data does something a little bit differently. So it surfaces what some of those mechanisms are, so the things that don't quite fit neatly into a category, the experiences that don't show up in survey responses, for example, that might be leading to why some of these gaps exist or what we could be doing differently. So in the context of this report, one of the clearest examples is probably unmet need. So the quantitative data gives us a figure, but it's the qualitative and the lived experience evidence that probably is going to be more likely to tell us what it actually costs families to navigate a system that isn't working for them. And so there's also a validity argument here as well. So the data that hasn't been stress tested against lived experience is more likely to contain assumptions that might distort that picture. And so bringing quantitative and lived experience evidence or having lived experience input in the analysis or understanding of that quantitative data or qualitative evidence makes both of these stronger in my opinion and experience. The first is to audit what already exists before you start. So, not just what's easy to find in academic databases necessarily, but this could also include what's been produced by advocacy organisations, community groups, and people with disability themselves. So, a lot of important work sits outside of the places that researchers typically look. The second is to be explicit in the methods about the limitations in the data that you're using. So again, this is not a defensive footnote, but it's a genuine part of the analysis. So if you can't see a particular group in the data, say so and say why that matters. Naming that gap is actually very useful and very important. Pretending it isn't there isn't. And the third is to think about accessibility from the start. So who will actually be able to read and use what you produce? Are you designing for them? That means plain language, accessible formats, and being clear about what your findings mean for people, not just for other researchers.
Speaking. Thanks, Sue. Just to kind of move to a bit of a conclusion. So what our approach offers as a whole is a level of honesty and transparency that's not often acknowledged. So I think like through showing how and where data is collected and created and who's visible and who's missing, we make it clear that data is not neutral, but it is actively constructed through categories, decisions, and narratives. And our aim in doing that is that the disability community can feel more ownership over data by having more transparency and clarity about where it's come from. We hope that people will feel more enabled to shape it to reflect who they are, and that data can feel less like a category or label imposed upon people and more like something they can participate in creating. We know we're not solving everything, but we hope that this more transparent and accessible approach can form a starting template for other researchers on how to present disability data. And we also intend that in presenting the missing data gaps, we're signposting areas in significant need of research into the future. A couple of just final takeaways, which are aligned with what Caitlin and Steph have already said. Just to bring it all together, I think a big takeaway is doing research in partnership and collaboration is really vital to this being able to happen. We couldn't have done it as comprehensively or with as much integrity without the combination of research, advocacy, and lived experience. And the other key takeaway is about transparency and accessibility. So just to add to what Steph has said, I'll pose that as a bit of a call to action to researchers and institutions collecting and analysing data. So first, to be bold and reflective in how we present data, making assumptions visible and being upfront about the limitations of data sets. Second, to build in nuance and responsiveness to how disability is defined, including most importantly by those with disability. This matters for capturing the full diversity of disability while still enabling meaningful comparison across data sets. And finally, thinking about accessibility and inclusion from the start. And I think that this was something that Steph was going to point out in one of the videos there, was around including people meaningfully from the beginning of this process, co-designing together, auditing everything that's out there, so that we can measure things accurately and reach and resonate with the people who the data is about and make it meaningful. Thank you, and I'll pass back to Sue.
Sue speaking. Thank you, Tess. Thank you to the CIDA team. Thank you to Caitlin for talking today about lived experience and the importance of that in this project. And also thanks to Steph Dimov, who provided us with a lot more material than what you saw today. And as part of the materials after this event, we will share a link to the full Steph video, which is more than 25 minutes long, and goes through quite a few questions about the experience. There was a lot in that session about, and that case study about directly to the questions that had been submitted by people beforehand. So we've heard the challenges of fragmented systems, missing data and missing voices. And we also heard about why accessible, strengths-based and publicly available data matters. And importantly, also about the role of partnership and how lived experience, advocacy and research can come together to create something that's more useful, more trusted, and more connected to what communities actually need.
So for our next session, we're going to zoom out a little bit. We've just looked at disability data through a community and partnership lens. Now we're going to look at disability data in a broader system context. And as I mentioned in my intro, disability and linked disability data has been an absolute priority for the disability community. And our next speakers are helping to shape and strengthen Australia's disability data system through the National Disability Data Asset. I'm very pleased to welcome Jennifer Poole, who is the Director of Outcomes Data and Community Governance Team in Australia's Disability Strategy Branch. Very long title, in the Disability Strategy Supports and Inclusion Division in the Disability and Carers Group within the Australian Government Department of Health, Disability and Ageing. And Jennifer's also joined by her colleagues Rebecca Hurley from the Australian Institute of Health and Welfare. And we did note that there was a comment or a question in the chat about the budget measure around the survey of disability and carers. And Rachel Price from the Australian Bureaus of Statistics. So thank you for joining us and giving us an update on where we're up to with the National Disability Data Asset. And I'll hand over to you, Jen.
Excellent. Thank you very much, Mary. And yeah, thank you for the opportunity to speak to you all today. As Mary said, my name is Jennifer Poole and I'm with the Department of Health, Disability and Ageing. My pronouns are she, her. Before I get into the presentation, I'd just like to acknowledge that I'm on Ngunnawal country today and pay my respects to traditional custodians of the land. I also acknowledge that everybody's coming from many diverse lands across Australia. And I'd like to extend my respect to all Aboriginal and Torres Strait Islander people that are here with us today. Yes, I'll very much welcome the opportunity to talk to you about the National Disability Data Asset, the NDDA, in short, and in particular about how data is brought together, governed, and can be accessed responsibly. Mary already alluded to the fact that I've got Beck Hurley from the AHW and Rachel Price from ABS in this meeting as well, on this session. And they'll help me to answer any sort of questions you might have about accessing key data assets. And that includes the National Health Data Hub, NHDH, and the personal level integrated data asset, PLIDA. So the presentation is structured to move from an overview of what the NDDA is through its core governance arrangements and into how data access works in practice. And we'll provide also details on both PLIDA and NHDH access pathways, as there are the two main integrated data systems supporting NDDA projects. And yes, obviously encouraging you to raise any questions about anything that we'll be raising here today. Next slide, please. So, thanks. Yeah, first I'll just provide a very brief overview of the NDDA. I'll try to keep this short, as I understand that you've already received some relevant background and information material around this. The NDDA is a commitment under the Australia's Disability Strategy and using the identified data from multiple government agencies as well as states and territories. Its purpose is to improve understanding of the experience of people with disability and the NDDA seeks to achieve that through the development of the disability flags, as well as reporting outcomes under the Australia's disability strategy. And there are a couple of links in the slide if people are interested in understanding a bit more about that. As I previously alluded to, the NDDA projects are currently supported through the integrated data systems, so that's PLIDA and NHDH. Be moving to outlining what the NDD core governance arrangements are, which are basically a key element of the NDDA project. So the NDDA core governance is co-governed by Australian state territory governments and the wider disability community. And that's done through the NDDA Council and the Charter, as well as advisory panels. There aren't currently any active advisory panels, but there have been advisory panels, for example, on the development of disability flags. The NDDA Council consists of 3 Australian, 3 state and territory government members, 3 disability community members, and 3 disability data experts. The council meets about every quarter, and they usually have a very full agenda. The NDDA Charter sets out the principles for how data should be used, including what is acceptable and not acceptable. Again, there's a bit more information if you click on the link as to the NDDA Charter on the NDDA website. Next slide, please. So the next 2 slides explain how project proposals are reviewed. So I firstly want to cover the role of the Disability Informed Ethical Oversight Panel, and then we'll also talk about the criteria used to decide what counts as an NDDA project under the interim delivery model. So on the Disability Informed Ethical Oversight Panel, that's an independent group with disability and data experts, and they effectively review NDDA project proposals and provide advice on those. And they particularly look at whether projects cause harm or bring benefits for people with disability and makes recommendation. They meet about monthly, but if there are a lot of project proposals, they can also meet fortnightly, and basically to ensure that we can get through proposals in a timely manner and researchers can get an outcome, basically. Importantly, the final approval decisions is made by data custodians. So not the panel itself, they just provide recommendations as to whether a proposal should proceed. But data custodians do make the final decision on that. Next slide, please. So just briefly on the interim core governance arrangements. So the Council recently agreed in principle to the below NDDA project criteria. So all projects will be considered an NDDA project if it meets one or more of the following criteria. So the first criteria is around the project title, objective, or scope explicitly mentions a focus on disability. The second criteria is the research question explicitly mentions a focus on understanding, improving, or evaluating outcomes for people with disability. And then the third one is around the data access request includes NDDA disability flags or NDIS participant data to explicitly design a research cohort of people with disability. I want to stress that these criteria are not final and might change as the Council continues to consider the best approach. But I thought it would be valuable for the audience to get a sense of what the the criteria are to be classified as an NDDA project. Next slide, please. So the next few slides will just step through how to apply for access to PLIDA and NHDH data and what the access process looks like in practice. So here the slide just outlines the end-to-end ABS Data Lab access process, showing the 8 key steps researchers go through. I won't cover all the steps in detail and just try to focus on some of the key ones and also how the core governance sort of links in with that as well. So the first 3 steps involve the initial discussion, proposal submission, and review, where ABS and the researchers clarify what the project scope is and the data needs are, while also identifying any core governance requirements early to ensure they are built into the application. In step 5, the project moves through the required approvals, including data custodian approval. And prior to that, obviously, the review of the panel, basically. And then steps 6 to 8, that's from onboarding to active use of the data, and researchers complete onboarding requirements like training. They're granted access once all approvals are in place and can then begin their analysis with ABS oversight to ensure outputs meet confidentiality and agreed project scope. Next slide. So in terms of applying for NHDH data, broadly speaking, that is somewhat similar or goes through similar sort of process at a high level. But yeah, a good first step is to contact the AHW NHDH team to talk through your project and check if it's suitable and which access pathway to use. And to apply, researchers need to submit a project proposal that clearly explains what they want to do and how it aligns with the approved purposes of the NHDH. Sorry. Next slide, please. And this slide, similar to the one a couple slides before, sort of sets out a phased approach. It's got 8 steps as well, or 8 phases, and goes with the first phase shown at the top and the final phase at the bottom. So it begins with the feasibility stage, where researchers talk with AHW to test their ideas and check if it's suitable and get an initial quote. In the application stage, the proposal is developed in more detail, and this includes confirming the project or confirms whether the project meets NDDA criteria and providing any additional disability-specific information as well. And where relevant, the project then goes through NDDA core governance, including the review by the panel. And then following approvals, the project progresses through onboarding and secure setup to active analysis with strict controls in place to ensure data is used safely and all outputs are reviewed and approved before release. Importantly to note for both of these sort of pathways and processes is that this is often iterative process, with feedback provided along the way to refine and strengthen the proposal. And if a proposal is an NDDA proposal, then there's a good chance that my department will also get involved in some aspect of this this work too. Lastly, the last 2 slides. Sorry, Sue, if you can. Yep. The last 2 slides just provide a overview or high-level overview of the types of data that are available through PLIDA and the NHDH to support research. So the first one here is the data that's available in NHDH, and it's showing the breadth of linked data sources across health, disability, aged care, and demographics, along with their coverage and time periods as well. Items shown with a solid connection in that diagram indicate that that data is available to all approved all approved projects, while items with a lighter or conditioned connection indicate that additional approvals are required before they can be accessed. Again, there is a link in the slide to further information about data and the data items. And then, next slide, please. And this slide provides a high-level overview of the data available in PLIDA. Again, showing how a wide range of data sets are grouped into domains such as health, disability, education, income and taxation, migration and social supports. And these data sets can be linked to support integrated analysis across different aspects of people's lives. And again, there's a link to an ABS website that will provide some further details on relevant data items list, and can be accessed and downloaded. So I think that's it.
It is my absolute pleasure to kick off this second case study. We're shifting from building better access to disability data to thinking about how disability data can get itself designed and by whom. We're going to hear from a Griffith University team about an approach that brings together research, co-design, and citizen science to better understand disability experiences and outcomes. And I'm very pleased and personally chuffed to introduce Dr. Kelsey Chapman and Michelle Moss from QDN, Queenslanders with Disability Network. Kelsey is a researcher whose work focuses on disability, inclusion, and meaningful engagement in research and data. And Michelle brings lived experience, leadership, and a strong commitment to ensuring disability research reflects community priorities and experiences, and also runs a damn good conference. So please join me in welcoming Kelsey and Michelle.
Thanks, Sue. It's Kelsey speaking. We are so happy to be here today and to speak about our collaboration, Voice of Queenslanders with Disability. Next slide, please. I just want to take a moment to first acknowledge the traditional custodians of the lands that we're all meeting virtually. I'm on the lands of the Kombumerri people on the Gold Coast, and just pay respects to any First Nations people here and elders past and present. And just excuse my voice for being a little bit congested. I think I've had the winter plague that it seems to be going around. So if I have to cough, that's why. The Voice of Queenslanders with Disability is a really special project because it brings together three key areas of the disability data sector. So that brings QDN, Queenslanders with Disability Network, researchers at Griffith University, the Queensland government, I saw your heart, Andrea, who are funding the project, and of course, the fourth critical component, which is the disability community. And it is a co-design initiative where we have these four key sectors acting as equal partners, with co-design and citizen science really sitting at the heart of this work. Next slide, please, Sue. I can't see Michelle. I think she's here. Michelle, did you want to jump in talking about some of the context for this work?
Thanks, Kelsey. Yes, I am here. Hi, everybody. It's Michelle speaking, and great to be here with you all this afternoon. So I think why this work and the work that we embarked on was really out of some conversations with the Queensland government who funds this work, and to look at not only the context of how does the voice of people with disability and their families and the broader sector have the opportunity to provide feedback and inform policy gaps, but also opportunities where effort can be put in to look at what that could look like. And so this has been a journey over the last probably 5 years since we first started talking about this. And we know that there's the Australia's Disability Strategy, of which the Queensland State Disability Plan is developed under those same 7 areas. And we wanted to be able to have something that really brings through that lived experience and that level of information and data, and a way of ensuring that there was something that was at regular intervals to be building that story and building that evidence, and something that gave the disability community and families and carers and that broader sector the opportunity to be heard at scale. And so really it has been about anchoring that, as I said, in those 7 areas, and looking at what is that life like for Queenslanders with disability, how is it changing, and what governments and services need to act on so that it is reflective of what people are experiencing on the ground. Next slide. So in terms of designing that work, and it was very much a process with people with disability in partnership with research and university. And so Kelsey will talk more about the actual approach of the survey, but I just wanted to add in that it has been co-designed with people to shape the questions, language, modes and reporting. And we've had a team of citizen scientists, which over the 4 years now of the survey totals about 40 plus people as people with disability who are paid for that role of partnering and being a citizen scientist. And really it is about that lived expertise that drives the sense making and looking at the data. And we can talk a little bit more about the work of the citizen scientists, some of their experiences and insights, but I'll hand over to Kelsey to talk about the design of the survey.
Thanks, Michelle. So from an academic perspective, this survey is a repeated cross-sectional survey done annually. So we are asking similar questions, nearly the same questions across most of the outcome areas Michelle mentioned, at a similar time every year. And this allows us to look at how trends emerge over time and what's getting better, what's changing. It means that we have a new cohort every year. So some people are participating every year. Some people have participated 2 years, 3 years, or are new each year. And this allows us to both protect privacy, especially in small communities, particularly in rural and remote areas. And it also allows us to look at the trends rather than individual shaping. The questions are re-co-designed every cycle. So we have a quality improvement process, and then we also work collaboratively with people with disability to understand the survey experience. So what worked well, what was easy to understand, what was challenging, what did the pacing feel like, how did it feel as an experience overall? And then we pivot a number of decisions based on that reflection. Next slide, please, Sue. Obviously, for a survey like this, accessibility is at the heart of what we do. There are a number of ways to take part, and this is probably one of the most important things that the citizen science help drive and feed into. So the survey is primarily conducted online. People can do that with support or without support, whatever their preference is. We also do about 20% of the participation happens through alternative methods. So that's phone calls with a person. We do paper-based versions of the survey. There is an abridged, shorter version of the survey, particularly in residential accommodation settings and for people from culturally, linguistically diverse backgrounds. We do in-person, face-to-face chats through the survey, and then our citizen scientists also collect data in their communities through so many creative ways, like hosting their peer networks at a coffee shop and chatting about each of the different outcome areas, uh, and participating collaboratively like that. Ultimately, we strive for plain language across all of our materials, and to date, we have reached over 2,500 participants across the 4 waves. It's really important to mention that there is a large focus on trying to reach people who are hardly reached. So that included over the 4 years, about 20% of participants living in residential service settings. QDN does a fantastic job, supported by the Queensland government, to go into that setting really intentionally to make sure we're capturing data from people who are hardly reached by research. We've had about 5.4% of participants who are Auslan users as their main form of communication, and primarily nearly 50% have household incomes less than 50,000 per annum. So we are trying to reach as diverse of a group as possible, but really prioritizing people who are often left out of research. Next slide, please, Sue. So in the interest of time, I'm going to give a very brief overview of some of the data. Go check out our 2025 report. That will have, it's 100 pages. It's got some in-depth information into what we found, particularly over that 3-year period from 23 to 2025. But there were a couple things that we found that were improving. So most participants felt like other people treated them well, and they felt welcome and included in their community, and that they had access to a good GP. You can see that less than half, although it was an increase over the 3 years, report improved access to paid support. Something that's really important to note about this information and the data that we collect is we collect both quantitative data and qualitative data. And we do that really intentionally because whilst you can see most people have said other people treat them well, when we get into the qualitative data, that often paints a really nuanced or sometimes different perspective. And so the report is really based on marrying those 2 perspectives together. So it's easy to tick, agree or disagree, or strongly disagree or strongly agree on a survey. But what that actually looks like for your life is something that's of profound importance to our team. So we spend a lot of time working through and looking at the qualitative data and trying to represent the quantitative data with that nuance. Next slide, please, Sue. And that, of course, shows up in what's getting worse. So we had a lot of people who said they felt like their lives were getting worse in 2025 than they had been in the previous year. And that less people said they had a good job and had enough money to live well. I think that reflects what's happening in the country as a whole with ongoing cost of living crisis. And less people felt that employers in Queensland put people with disability in leadership positions, and less people felt they could get extra support if they needed it. Next slide, please, Sue. Like I said, the quantitative data tells a good story, an interesting story, one that's important to hear. But there is a story happening behind the numbers. And Michelle, I wonder if you want to speak to some of that.
Thanks, Kelsey. And I think that is the important part of the data and the story that sits behind the numbers, because there's some really strong evidence and information that people are giving, particularly around that experience of reasonable adjustments, which people talk about, that it doesn't happen as a matter of course, and it is essentially some of their experiences, whether it doesn't matter which service setting that is across the 7 areas. So I think that's a really important thing. We know that the cost of living pressures compound those disability-related costs, and that's certainly, and whilst we haven't released this year's report, I think it builds the story of the impact of those cost of living pressures, and particularly living on fixed income with the disability pension that hasn't kept growth of responding to the changes in cost of living. And, often those stories of inclusion have really been about individual leadership, not necessarily a systemic kind of approach. And we've been really fortunate, I think, to have a number of opportunities, and Kelsey will probably talk a little bit about this a bit more, to present some more detailed information around a particular policy area or portfolio area. And I think that's one of the amazing opportunities that this data gives, and the story behind the numbers, because it really is about where those areas are that are opportunities for doing something different, and really focusing attention in on reform and policy work that will make that systems change and help take from individual leadership to that systems level change. Next slide. Did you have anything else you want to add there, Kelsey?
No, I think you covered it. Thanks, Michelle. Sue and the NDRP asked us to think about some of the strengths and limitations of this approach. And so we wanted to do that as a little bit of a conversation. I think Michelle's point about the ability to use some of this data to really drill down into some specific pain points for people and for the systems and government as well has been really helpful. And having that married data of the quantitative and the qualitative together allows us to have a better understanding of what's happening both at an individual level and at a collective level. So that's been critically important. Some of the strengths, obviously, this data goes into a publicly available report, which I think is certainly a strength. That means that people can peruse it in their own time and use it to support their own advocacy, their own research, and their own systems change. It is co-designed throughout, so it wasn't just co-designed as a one-off. We continue to revisit co-design processes, do unpacking of the survey experience, like I mentioned, and readjust the formatting annually so that we're constantly being as up to date as possible for best practice accessibility and inclusion. One of the real strengths from a researcher perspective is the paid lived experience roles, that citizen science role. It's so critical to the work that we do and to reaching out to the community in new and innovative ways. They're our best champions on the ground, and working with them is such a privilege, first of all, for me as a researcher, but it is also keeps us accountable, continually accountable to the community. So I think that's one of our real strengths. Obviously, lots of ways to take part, which is both a strength and a limitation. Working with QDN for me, as well as from the research end at Griffith, is a pure strength that brings with it a level of community ownership and trust that allows us to really blend kind of our strengths together. Michelle, did you want to?
Yeah, Elsie, I was just going to, I think, add in there to, the role that Griffith has played in terms of your citizen scientists short course that you have as well, which has really been important in supporting our citizen scientists along that journey as well, and that's been a really important part of the work. And I think as well is that multiple ways to take part, that has really been led of thinking outside the box for the citizen scientists to look at those networks and how they engage and how they can bring together the people in their own networks. And I think that's been really exciting too, to see the creativity in that, because it is, as we all know, everybody is very time poor. It is a challenge to sit with a significant research survey that goes across so many different life domains and areas of people's life. And that's certainly, some of the stuff, as we talk about limitations of, the experiences of people in doing the survey. But I think the engagement and the approach that has been taken really has led to new opportunities for different parts of the community to have a voice and have some input.
Thanks, Michelle. Yeah, I think that citizen science course, just to mention, is sponsored by the NDRP, the Citizen Research Essentials course. And so our citizen scientists take that as part of their onboarding. One of the things that makes me the most happy as a strength is that we do have some citizen scientists who haven't had a formal employment before, who have then gone on to have formal, traditional forms of employment after, and have used the citizen science role as a leverage point for that. So that is a kind of good individual strength. As you mentioned, with limitations, from a personal perspective, it's a very long survey. So the resource intensity of both it being an annual cycle, but also a long survey, affects, people with disability, the participants, of course, us organizationally. So I think it's certainly a challenge. And that reach depends on known networks. So people who are outside of those networks are still hard to reach or hardly reached in that sense. One of the other challenges, I guess, from an academic perspective, is that it tracks trends in that cross-sectional design rather than longitudinal people individually. And it is a voluntary self-selected sample. So we do have some overrepresentation in some groups and underrepresentation in others. I would love for Michelle to just quickly speak to some of the limitations from a participant perspective.
That was Kelsey. And I think, that has certainly been participants for the time that it does take. But I think people also want to see and understand the so what, and the what impact is this having, what is the information doing to inform and reach the decision makers, and to ensure that it is being considered. So I think that's certainly something that, through different opportunities, is that feedback loop to be able to show and demonstrate the impact of where the information goes and how decision making is being shifted because of that. And I certainly know, that the report and some of the findings have been, picked up by the media, and they get cited in different articles depending on what the area is. And, just one example of recent times was last year. There was a significant increase in the number of people who said that they had an individual person-centred emergency preparedness plan. And I think, as well as the data telling us some of the gaps, it can also point to when some of the policy levers are in place that might be having an impact and making a difference. And I think certainly, the awareness raising about the person-centered emergency preparedness plan tool, but also some of those levers about the requirements for providers to ensure that the participants they support through the NDIS Quality and Safeguards Commission, that people have plans. So I think that's really important to look at, and we're probably moving into some of those reflections, Kelsey, of why that is important and the so what.
Yeah, I think, again, just to be really brief, that this whole approach really, to me, drives forward that people with disability, when they're provided the opportunity to share their experiences, are willing to do so when there is trust embedded and when there's accessibility and inclusion embedded within the process. And I think so often that's a secondary thought, and that's one of the strengths of this process, that that was the first thought. And so when you begin like that, it makes it really a trusting, but also a positive experience for all parties involved. One of my biggest reflections is that, particularly for this 2026 year, is that people with disability are tired of being asked to be engaged and to share while seeing that limited change on the ground systemically. And so I think that's something that we have to be considerate of and think through as we move forward in this period of reform, and trying to reflect as best as we can as a research team and an engagement team, the changes that are being made, because there are things that are happening on the ground within Queensland based on the outcomes of this report that are going well. So doing our best to communicate what that looks like is critically important. And I think the other thing for me is thinking through, when this is a survey designed for anyone with disability to take part. And so often thinking through the tensions between, a change for access for one group doesn't always match up with the access requirement from another group. And so really designing with that tension in mind. And I think that's where that citizen science and co-design approach is so important, because it allows us to raise those tensions and flesh them out really well so that we get the best kind of universally designed approach.
Kelsey, I'd just add in there that the other final reflection, because I know we need to finish, Sue and Mary, is around the partnership, and that last purple box you've got there, that it is about the uniqueness of a partnership across the research institution, a person-led peak body organisation and government. We look forward to continuing to do that work and amplify the outcomes and impact of the Voices of Queenslanders with Disability survey.
Well, thank you, Mary speaking. Thank you very much, Kelsey and Michelle, for sharing your experience. I particularly loved the way your citizen research approach is trying to reach groups that are often not reached in research. So particularly people living in residential settings, that is a really, and I'm sure people would love to learn more about your approach, about how you've done that and achieved that. But you also highlight a bit of a wicked problem in that there's so much that is happening for people with disability in their lives that's not always going well. And I guess I would I would suggest anyone who today has felt a bit activated by some of the discussion today. We're talking about data that's real about people's lives, to please do reach out and get support. I would also like to thank Jen and the team from AIHW for sharing around the National Disability Data Asset. I think there's a really strong appetite for more work and more understanding about what's happening in this space. Lots of questions about the value of linked data in the chat. A lot of questions about how to access the data. And also huge thanks to Tess and Caitlin and Steph via video for kicking us off with your person-centered approach, strength-based approach for looking for data that anyone could be able to find as well. And I think the more we can keep talking about how do we get the holistic picture that helps tell a narrative, not just for stories' take, but for actually making real and meaningful change in people's lives is absolutely crucial. So again, sharing some of the that change story about how data can actually improve people's lives. I feel like we've got another session lined up, Sue, which is about the next bit is how do we take the data to action. Massive thank you for everyone who's been here today. Thank you for sharing so generously in the chat your thoughts, and also a big thanks to our interpreters as well as our captioner for being here today, and wish you all the best for the rest of your day, and we really look forward to seeing you. We will be coming back to you with materials from today. We've heard about the possibilities, and we really want to keep this conversation going. So big thanks, Kelsey and Michelle, for wrapping us up, and yeah, have a great rest of your day, and thank you, everyone.